Hello guys, welcome back to my YouTube channel. If you are seeing my beautiful face for the first time, you are welcome to my channel, and do not forget to subscribe. And to my returning subscribers, I say thank you for coming back to see my beautiful face. And I love you as well. Okay, yesterday I posted a new video in regards to knowing myself and my channel. So I said I'm going to pick out some tips to help you on the new Nursing and Midwifery Council United Kingdom OSCE, because I wrote the new one. So let me start with what is involved. Now it has now gotten to, it is still same 10 stations, but it is now 15 professional values and 15 evidence-based, and they've added new procedures to the clinical stations. So I did the new one, and to be frank with you guys, it's not easy because you have a lot to read, you have a lot to learn, you have a lot to try to cram to your brain. But with these few tips that I'm planning to share with you guys, I believe you'll be able to understand it more and do well in your exams. So firstly, do not assume, do not assume at all. Anything you see there, make sure you ask the examiner. If you are not familiar with any instrument, if you are not familiar with any equipment, if you are not familiar with any machine, just ask. They are ready to answer your questions. They are ready to listen to your request. Okay, so do not assume. And all the instructions the examiner will be passing across to you, make sure you understand them very well. Like all the instructions like make sure you make use of the PPE, do out this procedure. You might not do any identity check, or it has been done, or your trolley has been cleaned. Ensure you grab all that, and in case you do not understand anything, just ask, please. I'm begging you, just ask. And then in some medications situations like intramuscular injections, subcutaneous, what else, VIP and vaccine administration, two identity check. I mean, two identity check, please. Ensure you remember that it is a big deal in the exam situation. So in case you are given anything related to medication, ensure you do the two identity check. That's another thing. Then read your scenarios very well. Sometimes they might have written one or two things in your question. Maybe you want to do you want to administer a drug, let me put it like bisoprolol, and in your scenario they might have written the blood pressure of the patient or the heart rate. Ensure you read your scenario very well, properly, before you start any procedure, so that you won't just get stuck in the middle and now feel like you are not getting what you're supposed to do. No. Also, in case you made any mistake from the beginning, maybe in your assessment or in your evaluation or in any situation or in any skill, and you find it hard for you to comprehend with the other ones, please, I beg you, don't allow that one to weigh you down. It is still better to go back to, I am not saying you should not do well, but it's still better to go back to go and retake just one station than to go back to retake about 5 to 6. It is emotionally draining. So it's better, don't even allow any mistake to weigh you down. You've done it, just put your faith in it that you are going to have success. Even sometimes the examiner might not even see the mistakes that you are crying about, that you are putting your mind into. Just ensure you keep yourself calm. Make sure the next procedure you'll be able to do well more than what you've done earlier. And all the mistakes you are making, don't let it affect you. Please, I beg you, don't let it affect you. What else? Okay, in case you make any mistake, please ensure you correct it immediately. You might not remember at the first instance, but whenever you remember, if it is something you can still rectify, please do. Even if you cannot rectify with your actions, but rectify with your verbalization, verbalize it. Let them know that you know the right thing. Let them know that you know the right thing for you to do in case of any clinical situations. So ensure you rectify your mistakes immediately. I mean, immediately. So let me move forward. Okay, because I wrote a lot of things here, but I will make sure to still keep everything to make it sure so that I won't bore you with too much tips, but I bet it is still going to help you in your exam. If there's any PPE, sometimes you see gloves, you see apron, you see goggle, please and please make use of them. Examiner might tell you that, okay, in this procedure, you should wear your PPE. Sometimes they will not tell you. Please, in case it is something related to you touching the patient, ensure you are wearing your PPE, especially your gloves and your apron. And then, okay, I said this earlier. Okay. Ensure you manage your time properly. Most times people do complain about this implementation station, which is just 15 minutes, and sometimes might not be able to finish these clinical skills due to the time allocated to it. But manage your time well. Do not rush too much and do not be too slow. Just be moderate. Be in the middle. Make sure you are not rushing too much and you are not too slow. Ensure you are able to manage your time well, because time management is part of what do make people fail in OSCE. So ensure you manage your time properly. Then please speak loud. Let the examiner hear you. Let the examiner know that you are doing one or two things. As you are doing the procedure, ensure you are speaking and you are talking loud. Let the examiner hear you. Let him or her, I don't know who your examiner might be, let them know that you are talking. And ensure as you are doing the skills, verbalize what you are doing. Verbalize continuously. Even if you are touching the patient, like just keep on verbalizing everything you are doing for the patient at that moment. And everything you want to do, please verbalize it. As you are doing the procedures, as you are demonstrating, verbalize it and speak loud. Let the examiner hear you. Also, be conscious of your environment. In my situation, because I did ectopic pregnancy and I saw it pasted on the wall nearby mouth for the patient, because the patient is going for an operation to remove the ectopic pregnancy. So sometimes you might not be in that kind of situation and you might see some things placed on the patient bedside, like cigarettes, like water. They can put anything, they can put any probes for you guys to see. So in case you are seeing anything being placed by the patient bedside, please ensure you take them away, unless it is what the patient needs, like eyeglasses. The patient will want to use that, like a working aid, the patient will want to use that. So if it is something like cigarette, like chocolate, like what else that the patient is not in need of at that present moment, please remove it from the patient's bedside. I'm begging you now, because in where I trained for the OSCE, I remember when I did our mock, the patient was new per mouth, and unfortunately I gave the patient the water that I meant by the patient bedside, that, oh, do you need it, do you want me to bring it closer to you? That thing failed me during my mock exam, because the patient is nearby mouth and I was even giving the patient water, which made the examiner to fail me. So be conscious of your environment, be conscious of the props that are placed within the room or in the area you are doing your exam, and ensure you are doing what is right at all times. Just imagine you want to administer a medication. Normally you ought to give about 10 tablets, about 2 tablets, and unfortunately when you want to drop it in the what you want to disperse it into, it drops 3 tablets. So do not assume that the examiner is not seeing you. There are cameras watching you in the room. Even when you enter, the examiner will tell you that there's a camera in front of you and there's a camera behind you that is watching you and noting what you are doing. So if you just believe, I ought to drop 2 tablets, and unfortunately I dropped 3 tablets, the examiner might not see it. My dear, the examiner is watching you. So ensure anything you want to do it right. Even if you not do it right at the beginning, ensure you correct your mistakes immediately. Correct it immediately. That person was failed because instead of the person to drop 5 tablets, the person dropped 4 tablets, and the person came back to write the implementation station because the person assumed that the examiner did not see it. Unfortunately, the examiner saw it, and the examiner failed the person due to that little mistake. Also, do not allow any mistakes you've done in your former stations to weigh you down. I think I've said that one earlier. And for your professional value, since it is now 15, I will, let me say, beg you, because I know it's not easy to read. It's not easy to cram 15 questions like that. It's not easy. And note the points under them, even if it's just like carrying it just like 1 hour in a day is part of it. At least it will sink to your head. So allocate about 1 hour of your time in a day, which is 24 hours, and go through the professional values, learn them, know what you're expected to do, and I promise you, you're going to pass. Yeah. And lastly, I want you guys to have faith in yourself, believe in yourself that you can do it, and make God your helper, because he's the only one that can help. When you are done with the exam, before you start and after the examination, pray to God for success, and I promise you he's going to answer it. Yeah, because he did mine for me, and I can boldly say it that it was God. Seriously, it was God. So I think that's the main things you need to note about this OSCE, especially the new one. And I think that's all. It's nice speaking to you guys. Please do not forget to subscribe to this channel. I love you all, and I wish you success in your new OSCE, success in your endeavors, and I love you all. Bye bye.